For a long time, he has been having problems with his heart. And even when he used to walk, he would walk short distances and start feeling pain in the heart. So we would go for medication. For over years, was just taking medications. So recently, I think 3 months ago, we were in our main hospital called Mulago Hospital in Uganda. And they found that the condition of his heart was worsening. So we were admitted for 2 days, and they did a procedure called angiogram, and they discovered that he had 3 blockages in his heart. So after doing that we were admitted on a Sunday, they did it on a Monday, then we were discharged on Tuesday. But on a Saturday, there was going to be visiting doctors. They normally come, they have a camp, foreign doctors. But I think some were from Nairobi and in Norway. So we are going to be readmitted for him to have stents fixed in his heart. But then on Wednesday, our doctor, his doctor, Dr. Kello, rang me and said, could you come here? I want to have a word with you. Then he said, I got a call from one of the doctors from Norway, and he says the camp cannot handle his case. He has been referred to India, the arrangements of coming here. Later on, he sent profiles of 2 doctors, Dr. Chiran Babu and Dr. Rajesh. So we read about them. So things started moving there. From then, we started looking for the visa. Our preparation.
Then I went for operation. And they were first observing what.
So then the doctors came and met us. And they also prepared both of us. They said, we have done the investigation. This is not going to be a minor operation. We have seen, first of all, they had an issue with the kidneys. They had, first of all, to treat the kidneys, to make them stable, because the doctor, she's a lady doctor, remembering the names is a bit difficult. She said, if the kidneys don't improve, it means he may require a dialysis machine to help with them. But thank God, by the time we went to the ICU to get ready for the operation, the kidneys were now working normally. So we didn't have that problem.
I think my team was led by Dr. Rajesh.
Yeah, the operation was really high risk. Because for us, we thought, okay, we were told it will take about 5 to 6 hours. But to me, I calculate it was about 10 hours. That is when he was moved out of the operation theater and was taken to the ICU. Operation, the whole process started at 7:30, so he was wheeled in the ICU at 6:30. So that you can see that period. They were still working on him. The operation had been done in our country. I don't think he would have survived. And I think that is what the other visiting doctor saw, that maybe this is a high-risk kind of operation. So Mulago could not handle. And first of all, what I like, so actually we are really grateful to the doctors, the team, the entire team, right from the various doctors and the nurses who are looking after him.
Yes.
The general management here, I was really impressed with their service, because every day Dr. Savita and other officials, they would come and find how we are, whether we are comfortable, whether everything was going on. So I feel the treatment we got here was first class, I believe. Yeah. Everybody looked friendly, and they were asking if there was anything wrong or something. They were always ready to help us about our experience here and about the doctors. But the doctors are very good. They really have that human heart, while handling the patient. And I promise when I go back, I'll write something, an article about our experience here and about the doctors. But the doctors are very good. They really have that human heart, while handling the patient.
And we got all his details somewhere in the first week or second week of September, probably second week of September. It was the material what we received was very inadequate for us to give a definitive opinion. But we suggested that we'll have to evaluate him once he arrives here, and then we'll form a plan of treatment. Like that, they arrived in the last week of September. On arrival, then we investigated him. We took some time for him to get investigated. We did a thorough checkup on him. And to our surprise, we found out that he had a very pretty bad heart. There were blockages in all the 3 vessels which supply blood to the heart. Along with that thing, the heart had suffered permanent damage because of previous heart attack, which had gone unnoticed because of his pre-existing illness like diabetes and hypertension. So as a sequel of that, his heart pumping function had grossly reduced with critical blockages in blood vessels. So we evaluated him and found that whatever the rest of the heart muscle is still functional, and that is ischemic because of these blockages. That is why he is having all these issues. And because of this heart problem, his kidney function also had deteriorated. He was having all these multiple episodes of congestive heart failure, which required admission to the hospital at his native, and the medications what he was receiving was very huge amount of medications were being given to him for a prolonged period of time. So after evaluating and considering all these things, we offered them surgery, that is bypass, along with or without, we'll have to decide that on table, with taking off the entire bypasses also, blockages also, that is known as endarterectomy, with a possibility. And it was a high risk procedure considering his low pumping function of the heart and his kidney affection also. But they agreed for the high risk surgery, and we went through the procedure, which was very challenging. But because of our team effort, we were able to do the procedure and manage him. Likewise, in the intensive care unit, which was albeit a prolonged stay in the ICU, nearly 4 weeks, no? More than 4, just about more than. Today we are seeing him sitting here in the room comfortably,
Just smiling.
smiling.